Do your knees hurt? Then stop overloading them all the time. We see the knee often gets the brunt of the stress and it can lead to more problems. So instead of taking out squats and blaming lunges and cutting out running altogether, let's look at the ways that you're doing these things and see how you might be putting more stress on the knee, leading to pain, stiffness, and injury. I'm Dr. Morgan Riggins. I'm a physical therapist at OPAL Movement Therapy. And today we're going to talk about what are the most common ways that we move that can put more stress on the knee and lead to chronic recurrent knee pain and injury. So, couple big things. And first, let's just look at the things that people always come in and talk to us about. They're like, yeah, my knees hurt when I do squats. And I say, okay, show me a squat. And it looks like this, or it looks like this. We can see there's something off with that, right? When we do a squat, we really want to disperse the work equally between the hip, the knee, and the ankle. So it's like 33%, 33%, 33% right here. But because our knees move well, and sometimes our hips get tight, or we don't have as much awareness of them, it's so easy just to throw the knees forward in a squat. So easy just to put all the load there. However, over time, structures in the knee may be like, hey, we're tired of carrying the team. Why don't you make the hips do some work? And a lot of times that requires relearning how to move through the hip. Lunges are a big one too. Oh, Dr. Morgan, I don't do lunges. I hate lunges. They hurt my knees. Well, let's see how you lunge. If you lunge and that knee dives in, that's going to put more stress on the knee. If I see it from the side and you lunge and your torso stays fully upright, all that load is going on the knee. It feels okay on my knee right now, but over and over and over, or if I don't have sufficient strength in the hip, that may put more stress on the knee. My runners, Morgan, it hurts when I'm running. Well, let me see a single leg balance, right? Because when we're running, it's a single leg sport. How's your balance? Well, if the knee is diving in, just standing here, that already tells me that the knee is going to take on more stress when we land and hop when we're running. What about a single leg quarter squat? Stand on one leg, little mini squat. Does it stay stacked or does that knee collapse in, right? From the side. Are they hinging at the hip, knee, and ankle to do the quarter squat? Or is it just the knee falling forward? The ways we do everything are the ways we do all the things, right? So we want to see in what ways are you moving that might be putting more stress on the knee. The two most common faulty movement patterns that impact the knee are going to be excessive hip internal rotation or adduction, basically the knee and the hip diving in. The knee is the bottom of the hip, so if the hip dives in, that impacts the knee. If the hip and the knee dive in, if everything fell in, we'd fall over. That's not happening. Usually the hip and knee dive in and then our shin rotates out and we get this torsioning effect or shear forces at the knee. Over time, with enough load, that can trigger a problem at the knee joint and the tissues around it. And so if we're doing activities where that hip and knee dive in, then that is going to overload those tissues at some point with just enough load, intensity, or volume, right? It might not be a super hard activity. Maybe it's just hiking, right? But maybe it's a certain amount of mileage or a certain number of hikes that finally sets things in motion. Maybe it is load. Maybe you've not been a runner, you haven't been running. You decide to go out and you go straight to a 3-mile run and that was too much load and that irritated something in the knee. Whereas maybe your knee would have done fine with just a mile, right? But it's that movement pattern that can put more stress. Stairs are a good example. This step has a red oval in the middle. Ideally, when I climb stairs, I would be straddling that oval and I can stay nice and stacked. But a lot of times, that knee likes to dive in on the way up and the way down. Even when I go downstairs, is that knee collapsing in? Sometimes that shows up on stairs as well. So single leg activities, double leg movements, right? In my squat, if that knee dives in, then it does put more stress on the knee. The second most common faulty movement pattern is when we load the knee before we load the hip. We talked about this in the squat, right? If my knee goes before my hip goes. And a lot of times if I ask someone to do a squat, like, yeah, I feel it in my knees right away. Well, if that's the first thing to move, then it's taking on all the load. You haven't dispersed the work through the hip first. Squats are a great example of where it's a full body movement. The hip needs to bend, the knee needs to bend, and the ankle. And the tricky part with knees is they just follow what happens above or what happens below. So we've got to have really good awareness of both. Now, both of these movement patterns can be really, really helpful to retrain, right? And why do they happen in the first place? The big one is that we do spend quite a bit of time sitting in life, right? We sit to drive, we sit to eat. A lot of us have to sit for sustained periods for work. And then we want to get up and we want to go lift weights or run or play golf or do activities that require good hip mobility and strength. If we're tight from our workday or years of being in the educational system, then our awareness of this region is not as good. Our knees have incredible range of motion. They continue to move well even when we have to sit a lot for work. And so the hip and the knee like to dive in, or the knee wants to take the load first. The cool part is we're just going to retrain it, right? Let's use all these examples and we'll walk through them one by one to practice. Now, let's talk about the squat first. So we talked about how we want it to be equal parts. That can be hard to learn just from the beginning. So I'm going to pull over a stool. At home, I would highly recommend not a rolling surface, right? Do this on a chair that doesn't have wheels, or do it on a box, like a box jump type situation at the gym. I am going to test myself and it will be a moving surface. So from the side here, if I want to put myself in a position to not overload the knee, I need to make sure I can access the hip and the ankle in my squat. So my feet right now are at 90 degrees. That means that the ankle has to bend a little bit, but not as much as like when I'm in my full squat. I want to slide my feet back, so now my ankle is bending more and I can access more ankle mobility in the squat. I'm going to scooch them back as far as I can without going so far that the heels pop up. So it's that sweet spot. And most of us find that takes effort, because when you're sitting at your desk, we're usually comfortable. We're not putting that ankle in an end range position, which also means that in the squat, we may not be used to accessing that ankle. If we're not used to accessing the ankle, then we'll just have to throw the knee forward to compensate. So we're going to practice setting you up for success. You're on your chair. You're going to scooch the feet back. Now I've pre-positioned that ankle. The shin is forward. Now we've got to involve the hip, right? I am going to hinge forward. So my back is staying stiff. It is my hip that is spinning. And that hinge is what allows my hip to bend. So here in this position, if we took the stool away, I'm in the bottom of my squat where I have equal parts, hip, knee, and ankle sharing the load, okay? Actually works pretty good with the stool. Now, that can be challenging, right? I mentioned that sometimes it's hard to access the hip, and so I just want to make sure you hinge at the hip, bend at the knee and ankle, and then in this position, to get up, we have to avoid throwing the knees forward, right? It's a good habit that you're used to, so we're going to undo that habit. You're going to hinge, and in this position, you're going to push the ground away, and it's really your hips and glutes that are getting you up out of that position. On the way down, same thing. We're used to just bending the knees. Instead, think about hinging. Send your hips back towards that chair, then you'll bend at the knee. If that's not going well, then we might just need to hold on to something like the counter or a foam roller, because we need to retrain that movement. Now, if you clean some of this up and it's still uncomfortable, that's when I highly recommend seeing a provider who can assess and see structurally, mobility-wise, do we need to look at the knee first, or is this just something where we can start to retrain the movement? Let's break down lunges as well. So with lunges, we saw in the beginning that sometimes the knee wants to dive in. That's going to put more stress on the knee. And we may try to initiate the lunge with loading the knee first. We'll start in this position so you can practice, but go ahead and place your hands on your hips. That way you have an idea of where they are. My feet are hip width apart, and I'm just going to start with a kickstand. So I'm going to put my back foot behind me in my lunge position. And notice my front portion of my body did not move. I didn't bend already. I want to stay upright. Place the foot there. That's keeping the weight on my front leg. So it's like 80-90% of my weight on the front, 10 to 20% on the back leg. In this position, I'm going to hinge at the hips first before I bend the knee. So instead of just bending the knee like this, I'm actually going to send my hip back and hinge. Then I could lower into the lunge. Let's try that again. So I'm up nice and upright, my hip's over my knee. I'm gonna hinge at the hip, then bend at the knee and the ankle. Otherwise, we skip the hip and we just put all the load on the knee and the ankle, and we wanna distribute it. A reverse lunge is kind of like the squat that we just talked about, but with one leg back. This is where we're trying to end up. So I need to disperse the work between the hip, knee, and ankle instead of putting it all on the knee. The knee also doesn't love having to do all the work all the time. If this was challenging, you could put a foam roller here to balance and then practice. You could even hold on to TRX straps. And then eventually the goal would be, instead of just doing it in a static position, could you step back into it and do repetitions? And could you progress to the point where you could alternate? I recommend starting with the reverse lunge. It's a little bit easier to incorporate the hinge. When we do a forward lunge, it's just much easier to stay upright. It's still possible to hinge like so, but it takes a little more practice, and if you're new to it, you might want to start with the reverse lunge. Let's also talk about step-ups or stairs. So I love this step-up just for teaching purposes because it has a red oval right in the middle. Whenever we go up and down stairs or work on step-ups in a gym exercise, it's really natural to want to put your foot right in the middle. But now you can see how my knee is in, it's diving in relative to my hip. This red oval gives me a little visual. I can put my foot on the outside of it, and now my hips, my knees, and my toes are stacked vertically, and they're hip width apart. In this position, my knee is in better alignment with my hip and ankle versus if the knee is coming in. If I start with the knee in, then when I go to load it, it's going to collapse and put more force on the structures in the knee, whereas by design, we're meant to stack through the lower extremity and then come up. And so that's a really good one just to practice. Can we keep the hip stacked? Now, the muscles that control this live on the outside of the hip. They are hip external rotators. They pull the knee out. The muscles on the front of the hip that do internal rotation, they pull the hip and knee in. We tend to be better at hip internal rotation. So it's like tug of war, and the front just wins. So the front likes to pull the hip and knee in. So it can help to put your hand on the back of the hip. These muscles live underneath the glutes. Or you can just put your hand on your hip here. But what I want you to think about is, can you think about that outer butt muscle driving the knee out as you come up? And then same thing on the way down. Think about that outer hip muscle as you come down. I'm going to flip so you can see it from behind. But if I put my hands on my hips, right below my thumbs live the muscles that I want to engage. I put it right here underneath my hip. If I put it in the middle, these muscles are long and stretched out. They're passively insufficient. They're not in a good position to work. Whereas if I do good alignment, hip over knee, knee over second toe, now these muscles are ready. I'm thinking about them as I come up, and then I'm thinking about them as I come down. If I don't do it, then my knee just wants to dive in. And this is not super tall of a box, so it wasn't uncomfortable, but over and over, or a higher box or more repetition, that can be a problem. Now, the same concept as the squat and the lunge, are you loading your knee first or using the hip adequately? So from the side, I want to place my foot. This isn't a very tall box, so I could just throw the knee forward to come up. But on a taller box, that might be problematic, or with added load, that might be problematic. So even on a lower, easier surface, I can practice the same concept as the lunge. Can I hinge and then come up, right? And then if I slide this over so I don't fall down, I can place the foot, hinge, and then put my other foot there, and then practice on the way down. Same thing on the way down. I don't just want to put all the weight on the knee. I'll actually send my hip back and distribute it. And part of this is all about learning what you're supposed to be feeling, right? A lot of us on squats, lunges, step-ups, we might feel the work happening in the knee, because it is, and we want to move some of that load to other areas like the hip, the knee, and the ankle equally. And so we're just putting you in positions here where you can feel the right muscles kick in. I'm at the point where I don't have to hinge, and I can stand up and down, and I feel my butt working. But if you've never done step-ups with that awareness, you may need to really practice kind of training it with intention and then coming up and down. And even for someone like me who's practiced, if I get like a 24 or 40-inch box that's really high, I have to really hinge to make sure I feel my hip because it's much harder and my knee wants to do more of the work. So you can see there's kind of a theme here, right? The knees love to move, they're very helpful, and they'll take on more load because it's easy. It's harder to access the hip and to get the hip muscles to turn on, especially in the context of our day-to-day routine. So sometimes it's not what you're doing that's a problem, it's how you're doing it. We just need to refine it. And if some of these weren't doable, then try adding something for hand support so that you can offload it a little bit. Or you might need to start with just something a little lower level. A lot of times, if you've had a long-term history with knee pain, these exercises are uncomfortable and they make you nervous because you're worried it's going to hurt. So we might just need to start lighter. Like, do you feel your glutes on a glute bridge? What about just sidestepping with a band? Kind of hit the foundation and then apply it to these more functional movements. These are all fantastic to help you get stronger and to prevent knee pain in the future. But we want to make sure that you're doing them well and feeling the work in the right places. I hope you enjoyed this video. If you did, please hit subscribe or follow us on Instagram. We post videos every day and we are all about getting more information and resources out to you so that you can move better.